Please state your boy's name, age, and type of cancer.
Muli, his real name is Shmuel, was diagnosed when he was 1 year and 4 months, and now he's 4 years and 6 months. He was diagnosed with NeuroBlastoma high risk with MYC amplified, and we did all the frontline therapy in Israel in the C-Open protocol. After he had the first relapse, he gets 2 more cycles of chemotherapy, TVD 2 and TVC 2 cycles. He had a huge fungal infection, so we stopped all the treatment, and we were recommended at this stage to do a big trip and enjoy the time that we have left. So we moved to Hershey, PA for a medical trial. It was a vaccine trial with Disatabile. We were in Hershey 6 months. He was still clear after the trial. And we moved to, I was flying back and forth to Michigan, so he was in the DFMO trial of Dr. Scholler for 9 cycles. Then he relapsed again. He had 2 cycles of MIBG in San Francisco in UCSF Medical Center without any chemotherapy or any other drug, only MIBG. And he was NED after the first cycle. We did another one as consolidation. And now we are in Sloan-Kettering, and the purpose is to do the antibodies, most 1 course at least, and after to do the vaccine trial of Dr. Kushner.
Could you please tell us about the first signs and the diagnosis process?
Muli had an anemia that was try to treat it with ferritin, but it didn't work. And he has a little bit of hypotonia in the legs. And we took it to the pediatrician, and he said that everything is fine. One night it was difficult for him to sleep, and I take him to the emergency center because I have a bad feeling, and I feel something in the stomach, in his belly, and I am a doctor, so I was allowed that yes, maybe I thought that he will have an intussusception, and it was not an intussusception. When we did the ultrasound, they see a huge mass in his abdomen, and after they made an X-ray and they see a few other things, and everything began. We did MIBG, and they see a lot of spots. He has metastasis everywhere in the bone. And we began the protocol.
So what were the first signs other than, I mean, you mentioned that he had a preconditioned anemia. And
yes.
So what were the first signs that you can now relate to cancer? And how long between these first signs and the cancer diagnosis?
I think the anemia was the first thing, and he was also FTT. He was not growing so well. And I have been with the doctor a lot of time, and I say it is exactly what he's eating, and he said no, everything is fine. So I think FTT, the failure to treat, was the first thing, the anemia, and he has also an hypotonia in the leg because the tumor was pushing compressing the cord. Mm-hmm. So it was a 3 sign that we had, and it takes months, and it's not that we didn't notice. I was with the doctor, but it takes months to make the diagnosis, and the doctor didn't do it. It was just at the same week that I have taken to the ER. I have been 3 days before at the doctor, and he said everything is fine. So.
How was he? How old was he?
1 year and 4 months.
From the first signs?
Yes. No. From the first, and maybe 9 months, maybe 6 months. I don't know exactly.
So at the age of 9 months, you started to see the signs, right? Around.
I don't.
Roughly,
exactly.
because it's a process. It's a growing process.
Exactly.
You saw something was not going well, and it took a few months. Until the age of 1 year or 4 months, to.
Yes.
Okay. So once you took him to the ER, and they made the scans, how did they identify the cancer, and how did they identify the type of cancer?
Okay, they made an ultrasound first of all, and they saw the mass. And the differential diagnosis for a mass in the adrenal at this age, it was quite fine. What is it? But they did a biopsy, of course. For a few things, they need tissue before the final diagnosis, and also they need to decide if it's high risk or intermediate risk before 1 year or 6 months. It depends if there is a MYC amplification. And Muli has a MYC amplification. What it's causing a so bad prognosis is the MYC amplification.
Okay. About the disease.
Mm-hmm.
Now you're a doctor. Doctor for what?
Before my residency, I want to be an OB.
OB?
I hope to be.
Okay. Good luck. Most of the people who will see this are not doctors. Please explain about the disease, the existing subtypes. You mentioned PIC, MYC. I'm not familiar with these terms. Explain it to me like I'm a 6-year-old.
Okay.
And when you go through the process, explain each thing, if it's rare or not rare. Sometimes it could be rare and not dangerous, sometimes it's rare and dangerous. Sometimes in some types of cancer, there is no difference between stage 1 and stage 4 in the treatment. Okay.
In NeuroBlastoma, you have 5 staging, 1, 2, 3, 4, and 4S. If a child is diagnosed before the age of 1, despite if he has metastasis, he has usually a very good prognosis, and it's 4S. After this, the child usually are or stage 3 or stage 4. Stage 4 if there is any metastasis. And Muli had metastasis, so he was stage 4. And after, you have to decide if he is high risk or intermediate risk. We have few things that are going to decide if the child is high risk, that is a less good prognosis, that is intermediate risk. You have stage 3 and stage 4, and you need to decide if it's high risk or no. The age is a factor. If it's more than 1 year and 6 months, it's high risk. But in the high risk, you have it's not very high risk, but you have the factor that are going to decide if the prognosis is going to be more difficult, more hard. One of the most important thing is the MYC mutation. MYC mutation is a chromosome. It's a mutation. If you see that there is any amplification, they are staining the gene of the cancer cell, and if they see that there is more than 10 copies of the gene MYC, of the part of the gene MYC, it's high risk.
So MYC is a part of the gene?
Yes, and that you stain all the genome, and you see there is an amplification of the genome of this part of the mutation. And Muli had so many of it.
But Muli was under the age of...
Yes, it was the only thing that was good. But if you take every thing that you can decide, that you can see what is more important in the staging, the thing that are the most accurate with the prognosis is a MYC. If you have MYC, it's not good.
And it doesn't matter the age. I mean, the age is less...
It's less important.
So Muli was a year and 4 months when he was diagnosed. And he had metastatic, so that was stage 4.
Yes.
And he had MYC.
So he was high risk.
So it was high risk.
Mm-hmm.
So he was, and that was NeuroBlastoma, right?
Yes.
So NeuroBlastoma stage 4 MYC.
Mm-hmm.
That's the diagnosis?
NeuroBlastoma stage 4, high risk, MYC amplified.
Okay.
The open protocol has a few parts. First of all, it's 8 rounds of chemo. After this is a surgery. After you have bone marrow transplant. After you have radiation, and after you have immunotherapy. For us, it was a very good part. Muli went to all the huge protocol very fine. It was clear of all the metastases before the surgery. After the 8 rounds of chemo, he had the surgery, he recovered very well. After 1 week, we were at home. He had the bone marrow transplant. It was very fun. 26 days we were in the isolation room, but it's very short. It was hard, but it was fine. He had the radiation. It was fine. He was just tired. He needed sedation every day because he was small. And after we had immunotherapy, you have two possibilities of immunotherapy, CH1814 with or without IL-2. We get it with IL-2, and it was very hard. Muli had a huge reaction the first night. He almost died. He has a capillary leak, but it means that the fluid are not staying in the blood vessel but are leaking into the smooth tissue. So the blood pressure is dropping. He stopped to give urines. And the pressure was 30 on 15. It was very, very low. They stopped everything. They took us to they give him dopamine for the blood pressure, and after what they decided, instead of giving him the infusion of the antibodies in 8 hours, as it should be in the protocol, we give it above 12 hours. So it was also hard. We done the treatment in the ICU we finished the first cycle in the ICU, and after we moved to another hospital, there was more accurate to this kind of treatment, and we did it, as I tell, in 12 hours. And it was hard. It was a hard treatment. It was very painful. Muli had all the time some complications, but they were manageable. He had once a pericardial effusion, that it's fluid around the heart. He had pneumonia once. Every time something else, but it was very manageable. And he was very, very fat. He was keeping so much of the fluid. It takes like 3 kilos in 1 week. I need to buy new clothes for the end of the treatment because all the clothes was too small, and after he was just urinating in 1 week after, we have the Muli, what we know, the small one. And we did everything. He had the Accutane also, but it makes the skin very dry. And we finished the protocol, and we were very hopeful and very happy. And in the last scan, until we need to move to the follow-up, we saw a relapse. One relapse in the humerus, one bony relapse.
The protocol that you were treated under, is this an Israeli protocol, a European protocol?
It's a European protocol. You have few randomization. No, we close one randomization. In my time, you have 2 options on drug therapy or chemo before the transplant. We received the CEM, but it was not the best. The Bumel is the best, and not everyone is getting the Bumel.
Where were you treated in Israel?
Jerusalem Hadassah Hospital.
And then the second hospital?
In Schneider.
Schneider?
But now in Hadassah, we know Muli was the first kids to get the immunotherapy.
So the immunotherapy is experimental treatment?
Yeah, everything. The protocol it's a protocol with some randomization, so it's experimental, because you have the immunotherapy with or without IL-2. You have few randomizations with the protocol.
How many children do you know in Israel got the same treatment as Muli?
Exactly the same with the same SEM protocol. I don't know, because Muli was, I think, one of the last of getting the SEM chemotherapy before the transplant. Everybody is getting now the Bumel, but I know a lot of children getting this treatment.
Who is the best doctor you could recommend other parents to visit? And where would you?
We have been in 2 hospitals. We have been in 2 hospitals. We have been in Hadassah and we have been in Schneider, and we come back to Hadassah after the treatment. I think the one who knows the more about neuroblastoma is is the head of the department of Schneider. It's Yaniv. But we decided to go back in Jerusalem. The treatment was much more easy for Muli. I think that the decision you take the protocol was the same, and you can take a second opinion if you really want. We have been in second opinion in Schneider at the beginning, but I don't think it's much different between the both hospitals. The treatment in Hadassah was much more smoothly for us. The daycare was more convenient for us, and the hospitalization too. We have been in the both, and we get back to Hadassah.
How long was the treatment, the whole cycle in Israel, from the beginning until the relapse?
1 year.
Okay.
1 year and 1 month.
Okay. So after 1 year and 1 month of treatment in Israel, there was the relapse. Muli was by then at the age of 2 and 5 months, 2 years and 5 months. What's next?
We saw the relapse. I wanted to do the MIBG therapy because I read about it a lot, and there was misunderstanding, let's call it like this. And we didn't do the MIBG therapy because it's not a treatment that we can do in Israel, and they did not really know how to get it. And they give him chemotherapy, 2 TVC and 2 TVD, plus local radiation, and Muli was clear at the end of the treatment. So it was not MIBG. It was not fine for the MIBG therapy. And when you are clear, there is a paradox, because everybody knows that you should treat a child that there is no evidence-based disease, NED. But it's not meaning that for 100% there is no disease. It's just meaning that you can see the disease. So it's like minimal disease, and it's better to treat when we have minimal disease. Everything is more effective. And but the problem is that the clinical trial, most of the clinical trials are usually open for child with any sign of disease. So there are very few treatments that you can have at this stage. And we know that the prognosis was very bad. Muli was high risk with 1 relapse. In all the paper, like the 5-year survival after 1 relapse in NeuroBlastoma is nothing. So I was looking for a treatment over the sea, and we go to the only treatment that was open. We have 2 options, but the treatment that was open for us was that we chose was the vaccine therapy in Hershey.
So after the first cycle ended and they saw the relapse, what were the considerations, and how did you make the decision to go to Hershey? From all the options, where did you apply, and what was the process?
There is not so much applying, because Muli already get antibodies. So we have 2 options, whereas the treatment in Sloan-Kettering and the other one, and the one in Hershey. Treatment in Sloan-Kettering, the CH1418 that he got during the treatment was an anti-GD2. But GD2 is something on the cell of neuroblastoma, and the antibodies was an anti-GD2. And the Sloan-Kettering antibodies is also an anti-GD2, so we went a different approach. So there was not so much option because Muli was clear of disease, and for the research it's better if you have any kind of disease, so you can not just show the follow-up, but you can measure everything. So we went to Hershey, and also we were recommended to stop everything, so we don't have a lot of choice as parents. We decided to continue to fight, and we moved to Hershey.
Was there any other place in the world that you checked for this?
Yes, we checked a lot of others, but there was no trial for children without evidence of disease.
So all the other places only were accepting only kids with
yes.
evidence for.
No, you have more option, but it's closing on opening clinical trial. It's what kind of trial you are going to give your child. It's very based on what happened at this time, because it's open and closed. I want the vaccine for him that I am going to have now, but it was closed.
So it's also a matter of timing.
A lot of matter of timing, yes.
So for better or worse, the only option you could find was in Hershey.
Yes.
And did you check also other countries other than the US?
Yes.
For example?
We checked in Europe, that was MIBG therapy. But in Europe, we already get the protocol. So what they recommended was chemo. And Muli was not, as such, he has the fungus infection, he almost died with it. He needed 3 surgeries in 4 days, and a lot of treatment after, and we cannot give him any more chemo. So it also closed some doors. But chemo is not curable for neuroblastoma high-risk relapse.
So the Israeli protocol is equivalent to the European protocol.
Yes.
And this is why you had it made less sense to go to Europe.
No, because in Europe there is not so much clinical trial than in America. And you cannot get any more chemo at this time.
So tell us about the second phase of treatment, the Hershey. You got there, how did you get along, how did you make the connection, and then tell us about the treatment itself.
Okay. The bureaucracy was very fast. Hershey was not used to have international patients. I think Muli was one of the first. We get a paper for the Israeli patient. It was funny. There is no international department in the hospital, nothing. So it was very, very fast. And they were very, very nice and really helpful. And when we decided that they check everything and they saw that we can, 1 week after we was there with Muli for 10 days, me and my husband. And they make a peripheral blood recurrence. They, like before the bone marrow transplant, they harvest peripheral cell, and they take the cell, and after we go back to Israel, and for 3 weeks they prepare the cell for the vaccine. And after we moved, we have a daughter. We moved together. We lived in the Ronald McDonald house for 5.5 months. And Muli gets the treatment. It's 4 courses of treatment. In the first and the second week, you get well, I need to remember. It was a long time ago. I think there is 1 week of chemotherapy, low dose decitabine chemotherapy, 2 injections on the week, I think 2 and 3. On the week 4, it's only blood test. So everything was outpatient, unless he had fever and neutropenia or something, but it's not lowering the count so much. And it was 4 courses like this. And we have 1 delay because the count was too low to begin the decitabine. And it was fine. It was an easy treatment. Only the shot was not so nice. But
so it was 5 months?
Yes.
Roughly between the age of 2.5 and 3?
Yes, approximately, yes.
Did they make...
A little bit, no, it was more than 2.5 because we had focused of, let's say between 3 and 3.5 approximately, because he has chemotherapy in Israel about a few months.
After he finished and after they saw the relapse, they gave him...
Chemotherapy, 2 TVD and 2 TVC.
Oh, so the 2 TVD and 2 TVC...
Plus local radiation.
Plus local radiation, that was after the relapse?
Yes, and then it was clear, and then we got to the decitabine treatment.
I see. So the chemo, the 2 TVD and 2 TVC, they helped because he was...
Yes.
Okay. Tell us a bit about the treatment in Hershey. Is it a biological? How does it work, etc.?
There is 2 parts. There's the decitabine, the chemotherapy, but a very low dose. It's just for like fine-tuning, let's call it like this, fine-tuning of the cell, of the white cells, the red cell, to increase the immunity response. And they took some cell of Muli, and they work with them in the labs, and they inject them back to the body. So the body will not fight the cell because it's cells from the body. And they should in the labs learn the cell to fight against neuroblastoma. And for us, it was clear all the treatment. It was almost 6 months after it stayed clear, and it was for us. It was very good. We were very happy. It was hard to think that he will still be clear. It was good.
So he was at the age of 3.5 when you finished?
Approximately, yes.
The test, what are the tests they did at the end?
MIBG. We did in the middle and in the end MIBG. And we see if there is any relapse, and it was fine. You inject something radioactive, the cells are...
they absorb the material?
Yes. It's radioactivity plus iodine. And the neuroblastoma cell absorbs iodine. So after the child is lying on a bed, and there is a radioactive sensor, and we can see where there is spot.
It's like PET-CT.
It's exactly like PET-CT, but PET-CT with glucose, and the neuroblastoma cell is avid to iodine, so it's with iodine.
So MIBG is like PET-CT, but they switch the glucose with iodine?
Yes.
Okay. After 5 months in Hershey, the MIBG showed no evidence of cancer. What's next? After
all the treatment in Hershey, before we come back to Israel, I wanted Muli to be in some of the computer in the state because the bureaucracy in the first relapse, all the time it takes to have any answer was very long, and I don't want to spend any more time if something should happen. So we made a second opinion at CHOP with John Maris, and also I sent a lot of emails to the head of 5 the most important doctor in neuroblastoma that I know about them, and we went to CHOP. He had a medical appointment there, so he was in the computer already. And we went also to UCSF Medical Center in San Francisco. We fly all the way back there because the head of all the COG, which is a group of neuroblastoma and everything, was there. So it was the thing that it was very important for us to do, to try to skip all the bureaucracy if there is going to be another relapse. Because in Israel, if there is any relapse, you speak to your doctor, the doctor speaks to another doctor, it takes time, and you don't have time. So now, if the child is already in the computer, you can speak directly to your doctor that is over the sea.
Amazing. Genius. So for one visit to the doctor, you're already in the hospital system, and you know the doctor, and from now on you have a direct channel of communication. Wow.
It's a non-written contract. He is a patient of him, so you can be in contact with him. And it takes almost 2 months to have the appointment in CHOP, and 1 month to have the appointment in UCSF. It's the time that you don't have when your child is relapsed. It's completely different to do it when you have time. And also I sent a few emails, and I have some calls with the doctor. And I know that there's going to be a treatment that's going to open with Dr. Scholler for maintenance treatment. And I was looking for a magical drug that will keep Muli clear, because Muli is without any evidence of disease. So I was in the medical conference in Texas, and I spoke with Dr. Scholler, and we saw that the trial was not yet open, but I was in touch with her. And when I come back to Israel, 10 days after, I fly with Muli to Michigan it was the second kids to be enrolled in the new treatment of the maintenance neuroblastoma DFMO trial in Michigan, in Grand Rapids.
So Dr. Scholler is from where?
Michigan, Grand Rapids.
And
Ellen DeVos Hospital.
So thanks for your visit to the conference in Texas.
Yes, I was there because I know that they're going to speak about the DFMO trial. It's the reason I went to the conference, and to meet with her and to know her.
And then you introduced yourself?
Yes. I wrote on an email before.
So you established contact, and then afterwards you perhaps, once you finished the tour in the US, you went back to Israel?
Yes.
And 10 days after, you came back to Michigan for this trial?
With Muli, yes. So we pay out the pockets in Hershey Medical Center, and I think it's important that people should know how many it costs. Out the pocket, the treatment, the decitabine treatment was almost $60,000.
That's for the 6 months.
Only the medical treatment, yes.
Only the medical treatment?
Not flying back, no food, no car, nothing. Only medical treatment. Around.
Okay. And of course, all the other flights in the US, the visits, the meetings with the doctor, you had to pay for each of the meetings.
Yes.
Why was the Hershey treatment not covered by your insurance in Israel? Because as everyone in Israel has a medical insurance from the state, and I assume that your treatment in Israel, in the Israeli hospitals, were all covered. Why wasn't the Hershey treatment covered by the insurance?
Because it was a medical trial, and the only thing in neuroblastoma that we know that the medical treatment will cover is 2 things: surgery, if the surgeon cannot do it in Israel, or MIBG therapy. And at this stage, Muli was not a candidate for the MIBG therapy because he was without any evidence of disease.
Tell us please about the Michigan chapter.
Okay, it's a drug, DFMO, that it's for maintenance. The purpose is to prevent any relapse. So it's a drug that you take twice a day orally, and one course of treatment is 1 month, and every 3 months you have an MABG, a CT scan, and if you need any other special test, and you need to be in Michigan in purpose to get the drug, because they cannot ship the drug over the sea. They need to see you, check the kids, and after you can fly back with the medical drug in Israel. So it was very easy. We didn't see any side effect. After 9 months, it relapsed, so we stopped the treatment. Usually the protocol is for 2 years.
Where was the relapse?
It was 2 sites of relapse. One in the first rib here with a bony relapse with a little mass around it, and one in the leg, only bony disease, metastasis in the bone.
Who manages the DFMO?
Dr. Giselle Scholler.
Giselle?
Scholler. She is in Van Andel Hospital in Grand Rapids in Michigan.
Were you happy with the treatment in Michigan?
Yes, very happy.
What happened after the relapse? I assume the trial in Michigan had to stop.
Yes, and as we understand, we're trying all the time to think before the relapse, what we're gonna do in case of relapse, because when a relapse happens, you don't have time. So we already knew, and the doctor knew, that we're gonna, if there is any relapse, we want to do an MABG therapy. So I have been in touch in CHOP, where my child was already in the system, and in UCSF. The treatment in both hospitals is the same treatment. So we want to go to CHOP because it's much more closer, Philadelphia, to Israel than San Francisco. But the bureaucracy was too long. In UCSF, after 1 month, we began the treatment, and in CHOP, it takes so long. They ask a lot of things, and it was just, we don't have time to spend, so we fly to UCSF. It was a bureaucracy decision between the both hospitals, but all the treatment will be the same.
How long have you been in Israel before you went to UCSF?
I think 1 month.
So there was 1 month between the...
Yes, he get a little bit dose of some chemo, so it just will not spread anywhere or something. But, and we need to average, in purpose to make the MIBG therapy, you need to have a stem cell. If you want to make it in full dose MIBG therapy, you need to have bags of stem cells. So we average some stem cell. We already have averaged in the past, but after MIBG therapy, you cannot average any more stem cells. So we average another bag of stem cells, and we fly.
So the treatment in UCSF is MIBG?
Yes, we did an MIBG therapy.
Tell us a bit about the MIBG therapy. What's the purpose, etc.?
The MIBG therapy is like the MIBG scan, but in much higher dose of radioactivity. So it just will burn the disease. It will go to the disease and burn it. And this child is radioactive after the infusion, so you cannot be with him for about 1 week, maybe a little bit less. So he's in a special room, and there is a special shield, lead shield, and instead you need to help him with urinate or changing diaper or something. You can go to the other side, but you stay in one side and you are out of the room. It was not an easy week for Muli, but thanks to an iPad that we got, it was fine. So if you have a child that don't know how to use an iPad, learning to use an iPad, because we just wrapped it a lot and he was playing with the iPad for hours. It was very good.
So the MIBG treatment is basically trying to burn the cancer cells, identify them with the iodine,
yes,
and then burn them with radiation.
Yes, they have the iodine plus radiation. They injecting together. It's going everywhere in the body, but it's staying in the in the tumor.
So it's basically a radiation treatment.
A radioactive treatment, yes.
So the tough part about MIBG treatment is that the kid is radioactive and you cannot get next to him. And he was for a week alone in a room.
Almost, but we go back and forth. So we have, if they don't do the treatment, we don't have 2 caregivers. We take 3 caregivers. I was, my husband, and my mother-in-law for once. On the second MIBG, I was with my mother and my mother-in-law. Because you can win more minutes inside, because everyone has an amount of minutes. But the hard part is only for 3 days. After, you can basically go back and forth. It's not so radioactive, it's fine. It's not painful, it's fine.
It's not painful?
No.
How many cycles of MIBG treatment?
You can do 2 MIBG. We have done 1, and we saw that Muli was NED after. It was clear after the first MIBG. So we decided to do another one. We wasn't sure what to do, but every doctor that we asked and said that if the disease responds no for MIBG, it's not sure that it will respond after. So it's not sure that it's good to keep it in the third case for another relapse or something. And it's sure that there is a cell that we didn't see. So maybe it's better to give him another dose and try to kill it. So we did another cycle. We have been for 1 month in America. In San Francisco did the MIBG treatment, that was 1 month. After we did, we wait 2 weeks. We come at the beginning. We made a bone marrow biopsy. We made a CT and MIBG in purpose to get into the trial. When Muli was in, we did the trial. It was 1 week in the room. After we wait for 2 weeks, he gets the stem cell back in America. We chose to stay there to get the stem cell in San Francisco because in Israel nobody gets MIBG therapy, and they didn't want to fly with a child over the sea, and if there is any allergic or any side effect, they didn't know what to do exactly with him. After we fly back, after they give him the stem cell back, and we make blood count twice a week. He gets platelet, whatever he needs in Israel. After we fly back to America, and 1.5 months after the MIBG, we made an MIBG scan, not therapy, and we saw that there is no disease left. And we decided, I explained, that we will do another cycle of MIBG to consolidation, they call it. And we stay 1 month, and we fly back and to Israel. We made, he gets blood count, he gets platelet, whatever he needs, blood, and when we fly to Sloan-Kettering, we made the scan in purpose to get into another study, and we saw that Muli is still NED.
So before we continue to the Memorial Sloan-Kettering chapter, how old was Muli when you finished the second MIBG?
Second MIBG, 4 and 5 months, or 4 and 4 months. 4 and 4 months. Mm-hmm.
Okay, about the MIBG treatment. Who's running it, and what can you tell other parents about this treatment?
We were at Kate Matei was doctor, Catherine Matei, very, very good doctor, very nice. We stayed there in front of the hospital in the family house. It was very nice because it was just in front of the hospital, so it was.
So tell us a bit the Memorial Sloan-Kettering chapter.
We just began, so we don't know a lot, but we hope to do the mouse vaccine. We hope to do the mouse antibody, 1 course, and see if we can treat the HAMA, which is the antibody against the antibody. So if you have HAMA, you cannot continue the treatment, but you can lower the HAMA. So we will see. We don't exactly know. The purpose is to make some antibodies, whatever we can, and after to move to the vaccine trial.
What is HAMA?
HAMA, it's human antibody against mouse antibodies, like the antibody that your body is doing against the antibody that they are trying to give you. So
they're going to take something and put it in mice and
they have already the antibody. They have the antibody and they give it to you. But if your body is making antibody against the antibody that they try, you cannot treat it. Like it's nothing. So it will get one course, and after we will try to manage it. And if not, you will go straight to the vaccine. If you can have any other antibodies before, you will get antibodies before and after.
And they accept Memorial Sloan-Kettering. They accept parents without any evidence of...
Yes, after relapse. After relapse, you can get this treatment.
Okay. So, looking back, in hindsight,
yes,
if you could go back in time, to which point in your amazing journey would you go, and what would you have done differently?
I would have raised more stem cell in the beginning before any treatment, because it's like gold after, and it's very difficult to have rest cell after transplant. So I will try to have rest more cell before, and I think it's the only thing that I will have done different. I think the most important thing.
Interesting. May a doctor have any objection to do it?
No, in Israel they have raised much more cell.
But in other countries?
Yes, in America you have raised much more cell also. It's something that you did.
So they didn't harvest the maximum possible?
No, they harvest just for the transplant. But now we know that it's more important.
But no, yeah, if you could go back, you would ask them to harvest much more.
Yes.
Okay. What would you advise another parent who is now starting to deal with neuroblastoma in a very young child?
I think it's important to know exactly what your child is getting and to check the drug and everything, despite if it's not your child. It's important because there is mistake in the hospital all the time. And to know what should come and to check that it's coming. And I think also it's important to know what is going to be your next step. Despite hoping you will need to use it, but to know, because when a big mess happens, you don't really have the time to think. And I think it's important to know who is the best doctor, and if you can be in contact with them, it's important.
For a parent who is just now starting the neuroblastoma journey, please mention a couple of names and hospitals that you recommend he should get in touch with.
Okay. In CHOP, there is Children's Hospital of Philadelphia, there is John Maris and Yael Moshe. In UCSF in San Francisco, there is Kate Matei and Dubois. In Michigan, there is Dr. Giselle Scholler in Grand Rapids. In Chicago, there is Susan Cohn. In Boston, there is Lisa Diller.
In Israel?
In Israel, there is Dr. Fried in Hadassah, and there is Dr. Ash and Dr. Yitzhak Yaniv in Schneider. But I know, but I didn't. There is more, but I don't know them.
So, should a parent get in touch with all of them? Some of them?
It depends. The treatment that you can have in CHOP, in Boston, in San Francisco, and in Chicago, it's the same protocol. So it's not important to know everybody, but sometimes it's made a difference with the bureaucracy. It's the time that you can get your child enrolled in the treatment.
Okay. Tell us a bit about, throughout the journey, the side effects of the treatment in Muli.
Muli has a very low side effect, no immune problem. Despite all the chemo that he gets, it's completely fine. The only thing is blood count will need to recover after such huge treatment. It's the only side effect. blood count, like platelet, you need to get platelet. It's a matter of time, it will pass. Everything that we can add by pocket and giving to him, I don't really care. It will pass.
How about growing, the radiation, internal organs?
Nothing. We are lucky.
And how many surgeries did he undergo?
He undergo big surgery or small surgery?
Big.
Big one, for the removal tumor. He had some surgery here also for the fungal, 3 surgery. He had port insertion, he had biopsies, he had one big surgery.
Did you ever use alternative medicine?
Yes.
Which one?
Anthroposophic medicine in the beginning, and also for the side effect, we use reflexology for the appetite.
So, okay. Anything you can recommend that did you see any evidence?
I think yes, it was helping for the appetite.
The reflexology?
Mm-hmm.
How many kids do you know that had a similar journey to you?
Nobody.
How many neuroblastoma kids do you know?
15. No, I know a lot here, but in Israel, 15.
Could you please mention websites and sources of information that a parent could use?
The NIH, I think?
NIH, National Institute of
Yes,
Health.
for the clinical trial. There's a list of all the clinical trials. I think it's a more important site.
Yeah, so the NIH website for clinical trials for neuroblastoma.
For everything.
Yeah. So that's your main source of information for the clinical trials?
Yes.
Do you know of any groups or Facebook groups or forums that you recommend parents to join?
There is a Facebook group for neuroblastoma, and there is also a list in the INRC, NB-INRC, something like this. A very good list.
Of what?
Of email, but somebody is sending an email, let's go to all the people, you respond, you can see, it's very good.
So it's a way
NeuroBlastoma, I think it's called.
NeuroBlastoma?
Mm-hmm.
And it's for parents to communicate with other parents?
Yes, there is all type of cancer, not only neuroblastoma.
Okay.
But you can choose what kind you want to be in touch with.
So this will enable a parent to get in touch with another parent with the same type of cancer? How did it affect the family?
It's hard. It's very hard. It's not what we planned. It's not what we are not making the career that we want. We are not with a friend as we want. We are not with a family as we want. The life is completely different.
And you have another baby?
Yes, we have 2 children.
And how old is the younger baby?
1 year, 4 months.
So she? He was born into the...
Yes, when I fly back when you were in Hershey, get the delivery and come back.
Thank you very much for sharing.
Thank you.